Hi, my name is Alexis Leva, and today I'll be presenting for my public health bio presentation, bacterial vaginosis. So what is bacterial vaginosis? Well, bacterial vaginosis is considered to be an emerging disease since within the last few decades, more people have been diagnosed with bacterial vaginosis and it is not eradicated. Bacterial vaginosis is a specific type of vaginal inflammation. This inflammation can be caused by an overgrowth of bacteria. The bacteria that usually overgrows and causes BV is called Gardnerella vaginalis. This is Gardnerella vaginalis. Gardnerella vaginalis was first discovered in 1955 and was thought to be a bad type of bacteria. Further research has shown that this bacteria is the most common type of bacteria in the vagina. It is a part of the vaginal flora and controls the pH range of 3.8 to 4.5. Gardnerella vaginalis also contributes to the health of your vagina. So who's most at risk for BV? Some environmental factors of BV include drinking, stress, and smoking. It is also reported that someone can be genetically at risk for BV if they have inherited genes that involve inflammation. Epigenetics plays a role in bacterial vaginosis by having the bacteria manipulate the cell genome. It is also reported that some people have lower levels of lactobacilli, which is good for gut and vaginal health. This is lactobacilli. So what is happening when you get BV? Some symptoms of BV include vaginal discharge, which can appear to be thin, white, or gray, pain, which can be located in the pelvic region, an itching sensation, especially around the vagina, and a burning sensation when urinating. And people with BV have reported a strong fishy scent after sex. What are some implications of bacterial vaginosis? Well, some short-term implications include fish-like odor post-sex, vaginal itching, vaginal pain, and a thin gray or white discharge. Some long-term implications include being more susceptible to STDs such as herpes, chlamydia, gonorrhea, and HIV, potential for developing pelvic inflammatory disease, infertility, preterm birth, spontaneous abortion, and endometriosis. Where is bacterial vaginosis occurring? Well, BV can occur in any population all over the world. It is present in the United States with 29.2% of people diagnosed with BV aged between 14 to 49 years old. In the U.S., 51% of Black women, 32% of Latino women, and 23% of white women are diagnosed with BV. The highest cases of bacterial vaginosis were prevalent in women that are aged 30 to 40 years old and women who have had multiple sexual partners. The prevalence of bacterial vaginosis increases due to the lifetime number of sexual partners, along with 84% of women who are diagnosed with BV report that they do not have symptoms. So how can BV be prevented, controlled, or managed? Some prevention can include properly cleaning your vagina with gentle soap, not cleaning inside your vagina but only around the vulva, wiping from front to back after using the restroom, wearing clean underwear, and also wearing breathable cotton underwear. Some controls to bacterial vaginosis include limiting sexual partners, always wearing a condom for vaginal and anal sex, using dental dams during oral sex, and not douching. Douching removes the beneficial bacteria in your vagina. Some management tips include, if you think that you have BV, visiting a local health clinic or assigned OBGYN to receive a test is best recommended. If you are diagnosed with BV, a healthcare provider can prescribe you an antibiotic. But to rid yourself of BV, you must take all prescribed antibiotics for the treatment to work. Is bacterial vaginosis related to any health conditions? No, it does not cause any health conditions, nor is it directly linked to any health conditions. But if this condition is left untreated, it can increase risk for developing STDs such as herpes, chlamydia, gonorrhea, pelvic inflammatory disease, and HIV. Also, if left untreated, it can cause infertility or premature babies in pregnancy. So what does BV have to do with public health? Well, bacterial vaginosis is considered important and relevant in public health since it is most common in women ages 15 to 44. It is reported in 2001 to 2004 that 21.2 million American women aged 14 to 49 were diagnosed with BV, also reporting that non-white women had higher rates of BV than white women. This condition can contribute to medical disparities, especially since 84% of women diagnosed with BV reported no symptoms. These are my references, and thank you for listening.